I always wanted to do something that I felt like I was connected to other people. In high school, the aptitude things always said, well, I should do something in IT or sit behind a computer, but I never really wanted to do that. I wanted to at least feel as though I was making a difference one-on-one with people or in someone's lives and be more connected. And I really appreciated the opportunity to use some of my other skills or abilities as far as communication or interacting with people. Even with what we do, some of the specialty, getting into mechanical ventilation and the particulars, there's a lot of critical thinking involved. You really, to excel and to advocate for the patients, you need to remember a lot of information. You've got to be able to work on the spot in intense situations with this stuff. And I'm thankful that desire I had kind of pushed me into this and to push through some of the difficulties and then be able to make a difference, you know, at bedside in people's lives in some really difficult moments. At CAMC, there are some unique opportunities for respiratory therapists. I'm from the coal fields myself, and there are a lot of rural hospitals that really help a lot in those areas. But I see people from where I'm from all the time here, because from the 4 divisions, you have spread out a lot of specialties. So at Memorial, we have a heart and vascular specialty, a new building with more in-depth things. They're always adding on to the procedures involved with that. We have at General, say, the trauma center. There's a neuro ICU with a lot of unique things. There's surgical trauma ICU. We have a standalone women's and children's hospital in women's and children's. So we got neonatal, pediatric ICUs. And then at Taze Valley, there's some unique things like the hyperbaric chamber that has a lot of advantages and unique therapy opportunities. And that's something we do as respiratory therapists. So everything from oxygen administration, nebulizer administration with medications, up to mechanical ventilation, whether it's invasive or non-invasive, when the patient can't breathe on their own, whether they have an issue after a surgery, whether they had a car crash and they come in to the emergency room, whether they're an adult or a pediatric patient, if they had an ATV accident out in the trails, you know, just enjoying something one day, they come in, we're there at every stage, from newborn to, you know, older patients at every stage of life. After you graduate, the test can be difficult, and maybe right off some people just pass the CRT exam, but they push and advocate for passing the RRT, which involves the clinical simulation test, which is difficult because it's not just abstract information. You're having to apply this information to specific clinical scenarios. And so it is valuable to have people be able to pass that, because that gives you some idea that even though they're coming out of school, at bedside, they're going to have the critical thinking ability to work through situations and really provide high quality care. And so within a year, we want people to pass that RRT exam. But there's encouragement for that. There's some help with study supplies and some practice exams that they have to, you know, work through and help support people. And there has been support. I've seen other people, maybe they didn't pass it right off or had some trouble, but in the end have through help or support. And that has helped the department just through that minimal competency that's ensured from passing that more difficult exam. And then even beyond that, there are different specialty certifications that are available, whether it's adult critical care, whether it's the neonatal peds specialist. And we advocate and kind of push for those, especially through the clinical ladder. There are a lot of things we do that I find very exciting and rewarding, and really what make me at the end of the day be really glad that I chose this career and feel that I'm making a difference, because there's another end of it that people don't see. At the end of the day, this is what I remember and stands out that I find very encouraging, is that I was there for a patient that was using mechanical ventilation, so they had breathing tube, you know, they were on life support. Our specialty really shows when there's an issue with that patient. And some protocol, you know, that we follow, some special information from one of the exams that we passed, you know, that we studied about, something within our specialty tells us about the dynamics of that patient's lungs, the issue they're having, and changes we can make on this machine to correct something abnormal. I would recommend other respiratory therapists work at CAMC, especially for the difference we're able to make for the patients in our community. That's a big thing I think of, being from the coal fields, growing up just 30 minutes away from here in Charleston, and then coming to work in a place that I will see people I know. To have an investment in your community, as difficult as it may be in times, especially in recent years, but being able to have an impact in your community and in surrounding areas. A lot of people come to CAMC from all over the state for different specialties or unique things we offer, or because of the high level of care. There's a high level of opportunity for different specializations, but also to grow and work within the field. I've definitely learned a lot from the relationships I've been able to build here with other staff members, and that's really important.